recognize that we have an incredible task ahead of us to meet the health needs of 19 million Floridians and 80 million visitors a year. And we do this with a $2.8 billion budget, 17,000 health professionals, and with 67 county health departments, a central state office, 22 children's medical services clinics, and 4 state labs, and a lot of other field work in between. We have focused on getting our house in order to reorganize. We are focused on core public health, on clinical quality and safety through professional regulation, and on disaster readiness. And I've already been tested through 3 key storms here, plus the Republican National Convention in Tampa. And we also focus on communication. Fundamentally, a Department of Health is a communications company. I look forward to returning to the conference next year where we can engage further in conversation about how we move from communicating with individuals to communicating with populations and really looking at risk communication. Again, I'm delighted to be here with you. This type of community outreach is entirely consistent with the Department of Health mission, which is to protect, promote, and improve the health of the people of Florida through state, county, and community efforts. And it's the latter that I see here. Thank you very much.
Thank you, John.
So just a couple of things that our group came up with, and I think some are quite interesting. One are do you feel development of patient-centered care and communication skills is important in healthcare? I think all of us would say yes, and we'd probably be berated if we said no. But I think really the patient buy-in is really important here. Patients that feel that we're starting off our conversations with good communication skills, asking about them, are probably more likely to give us correct information more than anything else. And it was brought up by the group that certainly even not only the physician but even the medical staff and these skills are important also. One of the other questions about how can we support this, and something that I didn't think of, is really getting this information out to our patients. So raising patient expectations that better communication skills are expected. So when they come in the door, they actually say, absolutely, you need to have those communication skills up front with us. So the expectations from patients, so maybe going through civic clubs, maybe going through things such as newspaper articles, getting the information out there with regard to what should be expected from your healthcare provider would certainly be something interesting. So I'll stop with those and let others talk.
I think just 2 things. I know we're so short of time. One of the things our group came up with is the importance of accountability. Kind of like you were saying, Dr. Paul, make us as healthcare providers be accountable for treating people the way that we know is the right way to treat people. And then we had a lot of fun thinking about what the impact of this might be. And our group feels that one of the things might be increased productivity. That's going to save us money. Decreased burnout, not having to replace nurses, physicians, it's going to save money. And then just the whole importance of being receptive to this idea.
Thanks. Paul?
Yeah, our group was very helpful in giving us some suggestions. And when we look at the question of the focus on patient-centered care and communication, how they solve other key issues, one was to improve outcomes. When you look at the formula for value of don't hurt me, heal me, and be nice to me, that all 3 of those are important in the value to a patient. Improved outcomes, improved staff and patient satisfaction are both parts of that formula. And as well as reducing waste in the system, repetition from inadequate communication. and ultimately resulting in decreased malpractice, which is also very wasteful to our system and extremely detrimental to that formula by increasing the cost of care. So I think all of those things were important for our group.
Thank you. Our members here felt the caring communication course is very important in a healthcare organization, and even they felt that it should be really done at all levels in the healthcare organization, including the janitor level. So that was very interesting. And they also felt that such experienced communication skills should be also be at the level of all healthcare continuum, not just in one organization, like from the healthcare organization to the insurer to the all patient advocates. And they also felt that training volunteers on communication skills to help as facilitators also in the institutions will be very valuable. The other thing came up that the supporting organization for this initiative can also benefit from taking the course and be part of the course. And so that can help them, either encourage them to even provide more support or at least get more support to this initiative. Thank you. That's what I mentioned the last thing, that they felt that if we invite the supporting organization or foundation to participate in the course will be very helpful and to increase that support.
It's a mechanism to really enhance the underlying support, financials, as well as just the commitment from the organization.
Correct.
Okay, as I said, if the facilitators can just make certain that what you've written down is, if it's just scratching, we're going to need a little bit more to capture the ideas, and then if you can pull that together and get it to Heather, we will compile all of our thoughts, get it out to all the institutions, and again, if anybody individually wants them, we will just give us your email, and we will send you that collectively as well. And Heather reminded me that all of the PowerPoint presentations will be available online. So thank you very much for participating and helping us, focus on the journey and help us learn how we can move the journey forward. I have to personally thank each of the organizations that have just done an outstanding job of really bringing this to life in their own spaces, and hopefully Northeast Florida will receive better care and more efficient care for all of the work. So thank you very much, and I'll turn it over to Yank to close the day.
Well, thank you very much, Bill. It's a superb job as usual, and thank you all. At least once per meeting over the last 6 years, we just had to re-say the Osler quote, "They don't care how much you know until they know how much you care."